Hi, this is Dr. Ira. We are going to be talking about veterinary hospital etiquette today. There are a lot of things going on at vet hospitals, a lot you don't see behind the scenes, and it is a very stressful situation for or profession for the doctors and for the staff. It is in the top three in suicide professions for the doctors, so it can be very stressful. So first off, there is never a reason to be nasty to the staff or rude to the staff. Everybody's working as hard as they can and really trying to help. So if you need an appointment, please call, make an appointment. If they can't take the appointment right away, they will call you back. If they don't call you back by the next day, then I would call them again to make an appointment. If you have an emergency and it is a true emergency, then try calling the hospital. Let them know you're coming in, get in the car and come down as fast as you can. But let them know, give them a heads up that there's an emergency coming in. Number one, to make sure they can handle the emergency. And number two, so that they're all ready for you when you come in and you don't walk in the door and say, I have an emergency. And they all look at you like, we didn't know anything about it. So it is important to give a heads up when you're coming down for that. When you come into the front desk, very often they're busy. They're checking people in, they're checking people out, they're taking phone calls. So just be a little patient with them. It's probably the toughest job in the practice. You have to greet people. You have to take money from people. They have to try and be as pleasant as they can and as efficient as they can with just, again, a lot of things going on at the front desk. So try and be patient with them. You might be sitting in the waiting room. You might be the only one there and they don't take you for 20 minutes. Well, there might be emergencies in the back. There might be treatments in the back. There may be surgery going on. There are other things going on, and we've been accused of having breakfast or having lunch while making people wait. And I can assure you, hardly any veterinary hospitals, none that I know, will make you wait while we're having a meal. So if there's something going on, we always try and have the receptionist let you know what's going on, if there's an emergency, and how much time it might take to get a doctor out to see you. If you have an emergency, then we will probably just take them into your pet into the back to see what the emergency is, stabilize them, and then give you a heads up what's going on right away. But there may be something going on that's much more critical than your emergency. When you come into the office, please explain what the issues are in as much detail as you can. Little things may not mean a lot to you, but they might mean a lot to us. Be as complete as you can. I actually do like when people come in with lists. If you make a list of all your questions and things that you need to get done or discuss, then we can go right down your list, and it's much more efficient that way. I really don't know too many doctors that object to lists, and I think it really does help everybody involved. If you have previous records from a referral from the vet hospital, please bring them with you so we can review them. If you're a first-time client and you're making an appointment for a wellness exam or for a medical problem that's not an emergency, try and send the records over, or have our hospital get the records from the other practice in advance so that the doctor who's going to be seeing your pet can actually take a look at the records and make sure that we have a full understanding of what's going on, what is needed. The front desk can take care of whatever vaccines are needed, so we don't have to waste any time while you're there looking for them. And it's much more efficient, and it's a better visit. It's more comfortable for everybody. If you have, this is in no special order. If your dog comes in and they might have been poisoned or drugged, please tell us the truth. We don't care what drugs you're doing. We don't care what you're doing at home. We just want to take care of your dog. If we see at least 1 or 2 cases of marijuana and toxicity or toxicity every week, please tell us the truth. We don't care. We're not going to call the police. We're not going to turn you in. We're not going to judge. We just want to take care of your dog. So we've had dogs come in with methamphetamine, heroin, cocaine. They've come in drunk. So just be very honest with us. If you're not sure, you call the family, see if there are any drugs around the house. Sometimes the relatives are there, especially older people will drop their pills on the floor, and then the dogs might ingest them and get sick from them. And if you tell us that your dog might have ingested something and you know what it is, bring the bottle or bring the packaging with you, but we will ask you to call poison control in advance. The reason we have you do that is that we will have to call them once you get here, and by calling poison control in advance, by the time you get to us, we'll have a full record of what the treatments are. The other thing is that they do charge, we recommend calling the ASPCA. I don't poison control. They do charge, but if we have to call them, we'll put an additional charge on it, so it's a little cheaper for you. And every so often they'll say, well, your dog ingested this or that, and you don't have to go to the vet. So it might save you a trip to come in. If they're really sick, just come in as fast as you can. If they're flat out, severe vomiting, breathing heavy, and respiratory distress, bring them in, and then we will deal with it from there. But if we ask you to call poison control, please don't argue with us. It really is for the benefit of your pet, and it also tells us how to treat the specific toxin or drug they might have gotten into, because we don't do that all the time. So we really rely on poison control to set up the treatment plan for us, and they're very nice to deal with. When you come in, please let us do our job. If you have a dog that's fractious, needs a muzzle, bring a muzzle in. If you don't have a muzzle, we will provide one for you. If we're trying to handle your pet in a certain way, and again, you might think that we're mishandling them. We're not. We're just trying to protect everybody. We don't want anybody getting hurt. We don't want the doctors, the staff, or the owners getting hurt, getting bit, scratched, and it's for everybody's protection. If you know that your dog has previously bit somebody or your cat has bit somebody, please tell us before we even start. It's very important. I hate to tell you how many times people have come and said, no, we've never had a problem with them. And then we find out there's a bite history. I know of 2 associate veterinarians that have had issues where they've been viciously attacked by dogs, and both of them wound up in the hospital. And there's actually a situation that put one of them in the hospital for 3 or 4 weeks. If you know that your animal is aggressive or has problems with people, other animals, we will deal with it accordingly. But if you don't tell us and somebody gets really hurt, we actually can sue you. And in both cases with these other veterinarians, they sued the owners because they were very severely hurt, and they did win the cases. So you will also lose your household insurance if you don't tell them. If you have certain dogs, especially like Rotties, Pits, the insurance is questionable to begin with. Most insurance companies don't like to give you insurance for your house, but you will definitely lose it if there's any records of dogs biting, and especially if there's litigation. If you have a question and you call and we don't call you back in a timely manner, we will call you back. Very often it's so busy that we don't have time to call you. We may have the receptionist or a technician call you with the answer just because we can't get on the phone. If we are busy, we will call you by the end of the day. You might get a call 9 o'clock at night, but you also might get a call back right away. So once you call, please be available. I hate to tell you how many times I've called somebody back 5 minutes later and they're not available. And it's tough because we're missing other calls that we could be taking, and it's just something we would like to get done. Answer your question as efficiently as possible and then move on. So please be available once you do make a phone call. If you have a question about the surgery we're doing, the medications, the procedures, whatever you have a question about and you'd like a referral, please ask. I never would get mad about somebody asking for a referral. I would like to send you in the appropriate direction. If it was a neurologic problem, send it to a neurologist. Orthopedic problems, send it to a board certified orthopedic surgeon. But I would never get mad. I would actually encourage it. And once you had your referral, just have them send us the records so we can keep in the loop, and we will be happy to help you with a referral. Veterinarians that get upset because you ask for a referral, they're not doing their job. They're not doing right by you or by your animal. So if you have a veterinarian and you ask for a referral and they balk at it, then that's not the veterinarian for you. Every so often we do have a problem. It could be our mistake. Very often it can be our mistake with certain things. And we will apologize. We will make it right at no charge to the client. But we will apologize just so many times. We will not fire the person who's made the mistake. We will not rip them in front of you. We will take care of it in the back, but we will take care of it and we will apologize. I always tell people if we do have a problem, I'll apologize 3 times. After that, I'm done. We've apologized. We've taken care of it. We really don't have to have discussion anymore. If you're still not happy, then at that point, it's time for you to get your records and find another veterinarian. But we will deal with it, and we will take responsibility. We do have insurance at vet hospitals, and that's what the insurance is there for. We won't lie to you. We won't try and cover it up. I always tell people, don't chase a lion, don't let a lie chase you. So we will deal with it accordingly. But please understand that once we apologize, it's time to move on if we're going to continue our relationship. The other thing is, which is a touchy subject, are euthanasias. I can say that in 46 years, I never euthanized an animal I could help. It's a tough play because money's always involved. And we've had people come in with a 1-year-old cat that they want euthanized, and Uncle Johnny's coming over. Uncle Johnny hates the cat. Let's just put it to sleep. Or we're going on vacation. We don't have any place to keep the dog. We don't have anybody that can come in, so let's just put the dog to sleep. Doesn't work that way. If you come into our practice, we will refuse to do it, and we will not have any further discussions. A lot of times we'll get in surgeries or medical cases that you just don't have the money. If they're really severe and it's questionable whether or not they'll make it, and you decide to euthanize it, it's perfectly valid. But we've had foreign bodies come in on puppies and kittens. The people don't have the money, and after a certain amount of time, we will work it out where they'll give us a deposit and then they'll sign promissory notes. I can tell you that only 10% of the people that leave owing us money would ever pay it, but there's times that we will do the surgery knowing we're not going to get paid, but we're not going to euthanize a puppy or kitten because of your situation. So just be understanding that we have to pay the bills, we have to pay the staff, we have to keep the lights on, but if you tell us up front that there's a problem, then we can deal with it. We can work with it. That's being honest. Don't assume that you're going to get credit without asking. And we've had people have come back in and say, oh, do I have to pay the balance? Yes, you have to pay the balance unless previous arrangements have been made. So be fair, be honest with us. And in our practice, we never euthanized anything we can help. And that's just the fair thing to do. You can't make money on everybody. So we have to pick and choose our battles. And finally, when you go to check out after seeing the doctor or a technician appointment, you might want to ask if you can check out in the office, in the exam room. By checking out in the exam room, you don't have to stand in line. You don't have to fight with your dog while you're trying to write a check or pay or use a credit card or pay the balance. And it makes life a little bit easier. This way you can check out in the exam room and then you can just leave and you don't have to stop at the front desk where other things might be going on. I hate to see people after they've already waited to come in, they've waited to see the doctor, they've seen the doctor, and then they go and they have to wait to check out. And that's not a good thing it's really not a good thing for us. We really don't want you to wait if you don't have to. You've already put your time in. And if you ask to check out in the office or in the exam room, I think that you'll find it'll be a much better situation that you can leave. So those are some of the things for etiquette. Please be aware that everybody works as hard as they can. We try and do the best thing we can. We try and do the right thing for you and for your pet. So please just understand that sometimes things are going on that are out of everybody's control, and it might take a little extra time. And just be nice to the staff. That's all we ever ask. Hope this has been informative, and we will see you on the next visit to Practical Veterinarian.